Recognizing the signals. Why understanding symptoms matters. Our bodies have ways of telling us when something's wrong. These signals, called symptoms, are crucial. Ignoring them can be risky. Especially for middle-aged women, paying attention to changes is key. Early detection often leads to better outcomes. Knowing your body empowers you to take charge of your health. Common respiratory troubles: fever, cough, shortness of breath. Respiratory illnesses are common, especially among women over 40. Fever is a sign your body is fighting something off. Coughing helps clear airways of irritants. Shortness of breath can be alarming, signaling a deeper issue. Sometimes these symptoms are mild and temporary. Other times they might point to a more serious problem. Beyond a common cold, infections, heart issues, and more. One common cause of these symptoms is infection. The flu, pneumonia, or even COVID-19 can cause respiratory distress. However, heart problems can also manifest as breathing difficulties. Arrhythmias or irregular heartbeats might feel like skipped heartbeats. It's crucial to consider all possibilities. Other factors like stress, allergies, or even acid reflux can contribute to these symptoms. Section 4. When to worry. Seeking medical advice and treatment. Knowing when to see a doctor is vital. If you experience a high fever, persistent cough, or difficulty breathing, seek medical help. Chest pain, dizziness, or confusion are also red flags. Don't hesitate to visit the emergency room if your symptoms worsen rapidly. Early diagnosis and treatment can make a significant difference. Section 5. Staying healthy, prevention, and lifestyle choices. Prevention is always better than cure. Simple measures like hand washing and vaccination can prevent infections. Maintaining a healthy weight and regular exercise boosts immunity. Managing stress through relaxation techniques like yoga or meditation can help. Finally, a balanced diet rich in fruits and vegetables provides essential nutrients for overall well-being.